Hey guys, this is Jason from EdulogiX, where we teach you logic behind things. Welcome back to my channel, and in this video I am going to discuss the top 5 things that you must know if you're planning to start your nursing registration procedure in Australia, which is OBA, Outcomes Based Assessment. If you do not know about the procedure, I have done a previous video about it, a detailed step-by-step video, and I'll try to put the link of that video in the description box below. So let's get started. So the first thing that I want to tell you is about checking your eligibility for registration. So I have worked with a lot of registered nurses from various parts of the world, and they come from different countries and qualifications. So it's important to know whether you are eligible to apply for nursing registration in Australia. Now there is no one size fits all type of answer for this, because each country has its own nursing qualifications. However, there are I can say, some blanket umbrellas. So for example, if you are a registered nurse from India with a BSc Nursing 4-year degree qualification, you are preliminary assessed to go ahead with the OBA procedure. However, if you are a GNM, that is Diploma in General Nursing and Midwifery, which is a 3.5 years qualification from India, you are asked to upgrade your qualification. However, as you will notice that each country will have its own qualification, and AHPRA assesses each country's qualification differently. So my top tip is to check it yourself through the new self-check procedure on AHPRA's website. So now, what is this self-check? Self-check is nothing but it's a simple form on AHPRA's website where you can go and input some basic information such as your country from where you have obtained the qualification, what is the name of your qualification, the university name, and in which year you graduated. And automatically the AHPRA system tells you whether you are preliminary good to go ahead with the OBA procedure or not, as it will redirect you to the first payment gateway wherein you have to pay your assessment fees. However, let's say your qualification is not equivalent to AHPRA standards, so it will ask you to upgrade your qualification and will not allow you to go to the payment gateway. Please note that just going ahead with the payment gateway does not simply mean that you are all okay and you'll be assessed by AHPRA and your qualification is equivalent. Of course, they will need to see your qualification documents, your all the documents need to be attested, and there are some procedures. However, preliminarily, yes, the self-check helps you to understand whether your nursing qualification is a right fit for AHPRA's nursing qualification eligibility check. So now let's move on to the second top thing that you must know about your OBA procedure, which is very important: fees. So the preliminary fees for the whole OBA procedure is incurred in step-by-steps. So the first fee that you must know is the AHPRA assessment fee if you are good to go ahead with your payment gateway. So that will be around 640 Australian dollars. After the assessment fee, once your application is completely assessed, then AHPRA will tell you to go ahead and book your NCLEX examination. Now the NCLEX examination costs around 350 USD. And once you have completed your NCLEX examination, the next exam that you have to write is your OSCE examination. Now OSCE examination can cost you up to 4,000 Australian dollars. So this is the basic fees of all your examinations and what you are paying to AHPRA. And apart from this, the last and final payment that you'll have to do AHPRA is for your nursing registration. Once you have completed your OSCE, so the final payment that when you're applying your license is for your nursing registration fee, which is around 475 Australian dollars. Please note, I am not including any kind of fees which you may incur because of traveling or any kind of other expenditures like coaching programs, etc. These are the standardized normal fees that is incurred by all participants. So let's go to our third point now. So now we'll talk about the portfolio document attestation. So as I explained to you in my earlier video, that once you have done your payment and you have watched the 1-hour orientation module on AHPRA's LMS, then you will be asked to submit your documents. Now this is a very important step, and hence please pay attention carefully. So you have to submit all your nursing educational qualifications, your identity proofs, your residential address, etc. to AHPRA, and these are to be scanned and uploaded in a particular manner. And when you reach the portfolio stage, you will see a guideline document there which tells you who can attest your documents and how it needs to be specifically attested. So my top tip here would be to download the guidelines, take a printout, sit and read through the guidelines very carefully, and when you prepare your documents and take it for attestation, my advice is always to take the guidelines along with you and show it to the person who's attesting it for you, so that he or she also can go through it and attest it accordingly. Make sure when the person is attesting your documents, they should be able to put their signature. If they have a stamp, put the stamp. They should be able to put their full name, their license number, their profession, and also their contact number. I have seen many students making this mistake that, a contact number is missing, and hence AHPRA will send back those documents back to you, and you will be wasting a lot of time for this. So my advice for all the students is always to take a printout and go through it, take it to the tester and show it to the person so that he or she can attest it correctly. Also, after you have attested the documents correctly, you will be uploading those documents onto the AHPRA portfolio. Make sure that your documents are in a PDF format and all the documents are color photocopied and uploaded in the scanned version, and everything should be color scanned. Now let's move on to our fourth point, which is about the NCLEX and OSCE examination. Let's start with NCLEX first. So NCLEX exam is conducted by Pearson VUE, which conducts the examination in most of the countries. If you are not sure whether your country has the Pearson VUE center or not, I will put a link in the description box below, which you can check out, and it has a full list of testing locations across the world. The NCLEX examination results can take up to 6 weeks, and if you fail the examination on any attempt, you can rebook the examination again after 45 days. So there's nothing to be fearful about. So the second exam under OBA is OSCE, which is Objective Structured Clinical Examination, which basically means it's a practical examination, and it is conducted in Adelaide. So if in case you're outside Australia, you'll have to come to Australia after your NCLEX examination and then appear for the OSCE exam. The OSCE exam is jointly conducted by AHPRA and Adelaide Health Simulation Lab. It is currently conducted in alternate months. With each month there are 2 days which are booked for your OSCE examination, and in these 2 days 40 nursing applicants are tested upon the practical skills. The sessions are conducted in morning as well as evening. However, the maximum capacity remains 40. You will get your OSCE results within the 45 business days, and then if you have successfully passed the OSCE, you can move to the next step and the final step of OBA, which is registration, wherein you're required to submit your final fee payment, which is 475 AUD, as well as you have to submit your IELTS and PT certificate, your statement of service, your signed curriculum vitae, and also your documents, your educational qualifications once again. So the last and final thing that you must know about OBA is timelines. So timelines is very varied for each individual and their circumstances. However, I will try to give you a rough figure. Now let's say you have completed your self-check procedure as well as you have submitted all your documents in the portfolio stage, and then you have to wait for the AHPRA to give you a green signal to go ahead and book your NCLEX examination. Now the time between your portfolio submission and the time until the AHPRA completes your application assessment and gives you a go ahead, the time can be roughly approximately 12 weeks. However, if you submit the documents correctly, I myself have seen many times that the assessments are also completed earlier. However, the standardized or the norm, I would say, is 12 weeks. The second timeline that you must know is about once you have obtained the nclex-rn, go ahead from AHPRA, you will go and do your payment for your ATT on Pearson VUE website, and now that ATT number is generated by Australian Health Practitioner Regulation Agency or AHPRA, and now that also can take up to 45 business days. The last timeline that I would like to discuss is about your OSCE examination. Now this is very, very tricky, and I know that you all have many questions about it. Now the OSCE examination can take some time to be booked, specifically because, as I mentioned earlier, that there are only 40 nurses that they assess on every alternate month. And once you get your nclex-rn results, you will be asked to basically do your payment of your OSCE, which is $4,000. Once you do the payment of your OSCE fees, you will be contacted by the IQNM team or the AHPRA team, and they will give you some slots for the next available OSCE date, and which you can opt and book the examination. There's a little sad news here. Those who are offshore, you will have to wait a bit more, to appear for your OSCE because unfortunately the borders of Australia are not yet open. However, whenever things improve, we'll try to do again a video and update you about it. But yes, if you are onshore, it makes much more sense for you to write and appear and pass your NCLEX examination as soon as possible so that you can be on the OSCE queue and you can write your OSCE examination soon. So that's a wrap up for our top 5 things that you must know about OBA procedure. And if you like this video, please ensure to like, comment and subscribe to my channel and hit the bell icon. Additionally, if you have any more questions, I'm happy to answer them. Just leave the questions below and I'll try to answer them ASAP. I'll also leave the link of my website below, which you can go and check out, and there are a lot of good information blogs that you can go and check it out there. I hope you enjoyed this video. See you soon.